Hello, everyone. This is the Ontario Pharmacists Association educational program on post-COVID condition. Delighted today to introduce Dr. Zain Chagla, which you may have already been aware of, seen him on TV. He talked a lot about COVID-19 for many, many years. And Dr. Chagla is an infectious disease physician in Hamilton, and he's going to speak to us today about post-COVID condition. Just delighted that you're here.
Hi, everyone. Thanks for having me. So I'm Zain Chagla. I'm an infectious disease specialist and really here to talk about post-COVID condition. And so when we talked about the pandemic, we thought the story ended once cases dropped and vaccine rolled out. But unfortunately, a number of people, their new chapter began after their COVID-19 diagnosis. And this is a journey that they had, that was characterized with fatigue, breathlessness, dizziness, and a sense that they never really fully recovered from that COVID-19 diagnosis. This is what we now call post-COVID condition or long COVID. So when we talk about the definition of what long COVID is, the terminology depends a little bit on where you look. Health Canada defines post-COVID condition as symptoms that persist or recur beyond 12 weeks after the initial infection and really can't be explained by another cause. The World Health Organization uses a similar definition, symptoms lasting at least 2 months, usually starting within 3 months of the acute illness, and really, again, not explained by another diagnosis. The CDC takes a slightly broader view and incorporates any new or ongoing symptoms 4 or more weeks after infection. And so while the time frame differs, the theme is really the same. It's a constellation of symptoms that linger, fluctuate, and affect daily life long after the virus is gone. Diagnosis is really one of the toughest parts. So there's not really a single test or biomarker or scan that says, yes, this is long COVID. Instead, it's a clinical diagnosis built from the story patients tell, and importantly, ruling out other explanations. One of the first steps in diagnosis, again, is to do a thorough medical history and really understand that individual, their comorbidities, and potentials for other diagnoses to explain their symptoms before including the diagnosis of long COVID as the diagnosis of exclusion. The spectrum of symptoms is quite broad. So fatigue is probably the most common symptom. It's often profound and out of proportion to what people exert to get to that fatigue. Many people actually describe this post-exertional malaise, where even small activities trigger a crash, letting them down for several days. Others talk about brain fog, shortness of breath, palpitations, chest pain, dysautonomia, like POTS syndrome, where heart rates spike from autonomic hyperactivity. And these can overlap with other diseases, as noted above. So anxiety, anemia, thyroid issues, deconditioning, sleep apnea, which makes it hard to tease apart from what's truly post-viral and what's coincidental. So as a clinician seeing these patients, it means being systematic, making sure that we go through a thorough history, physical, appropriate diagnostic testing to ensure that the symptoms aren't related to an underlying disease state that is mitigatable and diagnosable, and also being empathetic, validating that the symptoms do exist while keeping a broad differential diagnosis. In terms of risk factors for long COVID, we've seen a few emerge. We see higher rates amongst women, amongst older adults, amongst those with a higher body mass index, and those with pre-existing chronic conditions. Importantly, those who had severe acute COVID, especially those who were hospitalized, received ICU care, were on specialized life support equipment, are very likely to develop long-term symptoms. But most importantly, it's not exclusive to these groups. Many people who have mild disease or even asymptomatic infections go on to develop persistent symptoms. It's that unpredictability, not knowing who gets better, who won't, really that adds another layer of complexity to patients and clinicians alike who care for them. This leads us to a lot of system level challenges. There's a limited awareness. A lot of clinicians haven't gotten formal training on how to recognize or manage post-COVID condition. There's evidence, or really there's not really much evidence. It's evolving, but we don't really have clear evidence-based therapeutics. And across Canada, specialty clinics are struggling with funding cuts, long wait lists, and a lot have had to scale back just as the demand is growing. In terms of pharmacotherapy, there's no really approved drug treatment, only really symptom based management, pacing, and multidisciplinary rehabilitation. For clinicians like myself, this can be really frustrating. You want to help, but you're working in a space where the science is catching up, the system isn't supporting the care, and we're really trying to work in the clinical reality of the space. So, this is why communication for patients with long COVID is so critical. The evidence is thin, but shared decision making is everything. So, being empathetic and validating patients, letting you know their symptoms are real, and believing them. Transparency is also key. Being honest about what's known and what's uncertain. I often talk to patients, look, we don't have the answers to this yet, but let's work together on the things that can help you feel better and alleviate some of the suffering. Work on getting you better day to day as compared to understanding the pathophysiology behind the disease. This is really setting goals, focusing on quality of life, supporting pacing, and really a multidisciplinary rehabilitation approach. As new evidence emerges, whether it's studies on autonomics, on antivirals, on immunomodulation, on different biofeedback strategies, we revisit the plan together. These conversations can be the difference between patients feeling like they're dismissed or patients feeling like they're empowered, that their care is being dealt with in a real, robust manner. So, if there's one takeaway, it's this: post COVID condition is real, it's complex, and it challenges how we think about chronic illness after infection. The path isn't just finding the perfect drug, it's about building care that recognizes, supports, and walks alongside patients while the science catches up to their underlying disease. Thanks so much for participating in this webinar.
Thank you very much, Dr. Chagla. That was it. Yeah, it is a complex disease, and I think conversations with patients to at least we can't give them a ton of hope. We can give them a little bit, and I think just recognizing that their symptoms are real to them and deserve listening to. I think the frustration we hear a lot about frustration in post-COVID condition. They don't know, and the physicians are uncomfortable too because there's not a well, I can just give you this pill to take this blood test and then we can, we're on our way to the next step. So yes, I really appreciate your time today, Dr. Chagla.
Hello everyone. I'm going to give a quick demonstration of the post-COVID condition decision support tool developed by the Ontario Pharmacists Association. But first, I'll need to describe the CAN-PCC guidelines upon which the tool is based. The Canadian Guidelines for Post-COVID-19 Condition, or the CAN-PCC guidelines, were developed as a collaboration between Cochrane Canada and the McMaster Grade Centre at McMaster University, and financially supported by the Public Health Agency of Canada. As a result of their work, the CAN-PCC team developed 92 evidence-based recommendations and 20 good practice statements in 6 domains concerning post-COVID condition, including prevention, testing, identification and diagnosis, clinical interventions, neurological and psychiatric topics, pediatric and adolescent topics, and healthcare services, systems, and social support. Their recommendations include a plain language description, certainty of evidence, and a recommendation strength, as well as a detailed summary of the evidence used to justify their ratings. The Ontario Pharmacists Association tool aims to help clinicians decide on the most appropriate clinical interventions for their patients with post-COVID condition once a diagnosis has been made. The tool draws on information directly found in the current CAN-PCC guidelines. Note that this tool does not address screening for or diagnosing post-COVID condition, though recommendations supporting these aspects of care are available in the CAN-PCC guidelines directly from their website. To use the tool, select all of the options that correspond with your patient's demographics and the reported symptoms of post-COVID-19 condition, and then scroll down to the bottom and hit Submit. The tool will then present the recommendations from the CAN-PCC guidelines that are relevant to your patient based on the provided clinical characteristics. There's a reminder at the top of the results page that the guidelines are just guidelines, especially given the limited amount of information we have about post-COVID condition. Decisions for care should be made in collaboration with the patient, taking their preferences and current clinical situation into consideration. The suggestions and recommendations are divided into categories, including drug therapy, non-drug therapy, health screening, and treatment modalities. They are further divided into suggestions and recommendations for certain interventions and against certain interventions. The language used to present the interventions matches the strength of the recommendations in the CAN-PCC guidelines. So, recommendation is used for strong recommendations, and suggestion is used for conditional recommendations. The actual certainty of evidence and recommendation strengths are provided below the plain language summaries. If you would like more information about the recommendations, each of them has a link that will take you directly to the recommendation on the CAN-PCC website, where you can look up more detailed information about the justification for that recommendation. Your search results can be printed or saved as a PDF if you would like to incorporate them into your patient chart. At the top of the page, there's a link out to a patient resource for post-COVID condition that was developed by the Provincial Health Services Authority of British Columbia in consultation with the CAN-PCC team. There's also a link to additional resources for healthcare professionals provided by CAN-PCC. And that concludes this demonstration of the post-COVID condition decision support tool developed by the Ontario Pharmacists Association. If you have any questions or comments about this tool, you can contact OPA using the Contact Us button at the top of the page.